Are the medications you take daily silently increasing your risk of a heart attack? In this crucial video, we'll uncover 6 common drugs that could be jeopardizing your heart health without you even realizing it. Understanding these hidden dangers is vital for making informed decisions about your well-being. If you're committed to safeguarding your health, don't forget to subscribe to Health 365 and click the notification bell. By doing so, you'll stay updated with our latest insights and tips to keep your heart in top condition. 1. Hormonal contraceptives. Hormonal contraceptives have been instrumental in providing women with effective means of family planning and reproductive autonomy. However, their use has been associated with varying degrees of cardiovascular risk. Understanding these risks is crucial for informed decision-making regarding contraceptive options. Combined hormonal contraceptives, CHCs, which include both estrogen and progestin, are available in various forms such as pills, patches, and vaginal rings. Research indicates that CHCs can elevate the risk of arterial thrombotic events, including myocardial infarction, heart attack, and ischemic stroke. A comprehensive study involving over 2 million Danish women aged 15 to 49 observed that users of estrogen-progestin combination pills experienced a 2-fold increase in the risk of these events. Specifically, this translates to 1 additional stroke per 4,760 women and 1 additional heart attack per 10,000 women annually. Notably, non-oral CHCs demonstrated even higher risks. For instance, vaginal rings were associated with a 3.8-fold increase in heart attack risk. The underlying mechanism is believed to involve estrogen's influence on coagulation pathways, leading to a prothrombotic state. Estrogen can enhance the synthesis of clotting factors, thereby increasing the likelihood of thrombus formation. This effect is particularly concerning for women with additional risk factors such as smoking, hypertension, or hyperlipidemia. Progestin-only contraceptives, available as pills, injections, implants, or intrauterine devices, IUDs, generally present a lower cardiovascular risk profile compared to CHCs. The same Danish study highlighted that progestin-only methods were associated with a slightly elevated risk, but significantly less so than their estrogen-containing counterparts. Importantly, the progestin-only IUD did not show an increased risk of heart attack or stroke, making it a safer option for women concerned about cardiovascular complications. 2. NSAIDs, non-steroidal anti-inflammatory drugs. NSAIDs are widely used to alleviate pain, reduce inflammation, and lower fevers. Common over-the-counter NSAIDs include ibuprofen and naproxen. While effective, these medications have been associated with an increased risk of cardiovascular events such as heart attacks and strokes. NSAIDs exert their effects by inhibiting cyclooxygenase (COX) enzymes, specifically COX-1 and COX-2, which play crucial roles in the production of prostaglandins, lipid compounds that mediate inflammation and maintain various physiological functions. Inhibition of these enzymes can disrupt the balance between vasoconstriction and vasodilation, as well as platelet aggregation, leading to an increased risk of thrombotic events. This imbalance is particularly concerning in individuals with existing cardiovascular conditions. Numerous studies have highlighted the cardiovascular risks associated with NSAID use. The U.S. Food and Drug Administration, FDA, has emphasized that the risk of heart attack or stroke can occur as early as the first weeks of NSAID use, and this risk may increase with longer use and higher doses. Importantly, this risk applies to both over-the-counter and prescription NSAIDs. A comprehensive review published in the European Cardiology Review examined the cardiovascular implications of both traditional NSAIDs and COX-2 selective inhibitors, COXIBs. The review underscored that NSAID-induced cardiovascular side effects have been overlooked for many years, leading to increased awareness of their potential risks. Not all NSAIDs carry the same level of cardiovascular risk. For instance, diclofenac has been associated with a higher risk of major vascular events, including heart attacks, compared to other NSAIDs. Conversely, naproxen appears to have a more favorable cardiovascular risk profile among NSAIDs. Given the potential cardiovascular risks, it is essential to use NSAIDs judiciously. Before initiating NSAID therapy, evaluate the patient's cardiovascular history and risk factors. Prescribe the minimum effective dose for the shortest duration necessary. Regularly monitor blood pressure. Watch for signs of heart-related side effects, especially in long-term NSAID users. For patients with high cardiovascular risk, explore alternative pain management strategies that pose less risk. 3. Thiazolidinedione diabetes medications. Thiazolidinediones, such as rosiglitazone, were designed to improve glycemic control in individuals with type 2 diabetes mellitus by enhancing insulin sensitivity. However, concerns regarding its cardiovascular safety have significantly impacted its clinical use and regulatory status. Rosiglitazone functions as a peroxisome proliferator activated receptor gamma, PPAR gamma, agonist. Activation of PPAR gamma influences the transcription of genes involved in glucose and lipid metabolism, leading to increased insulin sensitivity in peripheral tissues. While this mechanism effectively lowers blood glucose levels, it also affects fluid balance and lipid profiles, which may have implications for cardiovascular health. The cardiovascular safety of rosiglitazone has been a subject of extensive research and debate. A meta-analysis published in the New England Journal of Medicine in 2007 indicated a 43% increase in the risk of myocardial infarction among patients using rosiglitazone. Multiple studies have consistently shown that rosiglitazone is associated with an increased risk of heart failure. A comprehensive meta-analysis concluded that while there was no significant increase in myocardial infarction or cardiovascular mortality, the risk of heart failure was notably higher. Observational studies have yielded mixed results regarding the association between rosiglitazone and stroke or all-cause mortality. Some analyses suggest an elevated risk, while others do not find a statistically significant increase. The controversy surrounding rosiglitazone underscores the importance of vigilant post-marketing surveillance and comprehensive evaluation of drug safety profiles. Clinicians must weigh the benefits of glycemic control against potential cardiovascular risks when considering thiazolidinediones for diabetes management. Alternative medications with more favorable safety profiles are often preferred, especially in patients with existing cardiovascular disease or risk factors. 4. Certain antidepressants. Tricyclic antidepressants, TCAs, and selective serotonin reuptake inhibitors, SSRIs, are widely used to manage depressive disorders. While effective, both classes have been associated with potential cardiovascular side effects, which are important to consider when prescribing these medications. TCAs such as amitriptyline and nortriptyline function by inhibiting the reuptake of neurotransmitters like norepinephrine and serotonin, thereby enhancing mood. However, their pharmacological profile affects various cardiac parameters. TCAs can cause a significant drop in blood pressure upon standing, leading to dizziness and an increased risk of falls. This effect is primarily due to their antagonism of alpha-adrenergic receptors. These medications may also prolong cardiac conduction, evident in increased PR, QRS, and QT intervals on an electrocardiogram, ECG. Such changes can predispose patients to arrhythmias, including ventricular tachycardia and fibrillation. TCAs often cause tachycardia due to their anticholinergic effects, which can be problematic, especially in patients with pre-existing heart conditions. Given these potential adverse effects, caution is advised when prescribing TCAs to individuals with cardiovascular disease. Alternative treatments may be preferable in such populations. SSRIs, including fluoxetine and sertraline, selectively inhibit the reuptake of serotonin, leading to mood improvement. They are generally considered to have a more favorable cardiovascular profile compared to TCAs. Some SSRIs, notably citalopram and escitalopram, have been associated with dose-dependent QT interval prolongation, which can increase the risk of a rare but serious arrhythmia known as torsades de pointes. Consequently, the FDA recommends limiting the maximum daily dose of citalopram to reduce this risk. While less common than with TCAs, SSRIs can occasionally cause orthostatic hypotension and a slow heart rate. These effects are generally mild but warrant monitoring, especially in patients with existing cardiovascular concerns. Overall, SSRIs are often preferred over TCAs for patients with depression who have concurrent cardiovascular disease due to their more favorable side effect profile. However, individual risk factors and potential drug interactions should always be considered. 5. Pseudoephedrine. Pseudoephedrine, a common decongestant in many over-the-counter cold and allergy medications, is effective at relieving nasal congestion, but it also has potential cardiovascular effects, especially for people with heart disease. Pseudoephedrine works by stimulating alpha-adrenergic receptors, leading to the constriction of blood vessels in the nasal passages. This vasoconstriction reduces swelling and allows for easier breathing. However, this effect is not limited to the nasal tissues. Pseudoephedrine can cause vasoconstriction throughout the body, potentially impacting cardiovascular function. It can elevate blood pressure and heart rate due to its systemic vasoconstrictive properties. Studies have shown that in patients with controlled hypertension, pseudoephedrine may cause a modest increase in systolic blood pressure. There have been reports linking pseudoephedrine use to acute coronary syndromes, such as heart attacks. The drug's sympathetic effects can increase myocardial oxygen demand, potentially triggering cardiac events, especially in susceptible individuals. Pseudoephedrine may induce arrhythmias, including tachycardia, rapid heartbeat. These effects are particularly concerning in individuals with underlying heart conditions or those taking other medications that affect heart rhythm. Individuals with existing cardiovascular conditions, such as hypertension or arrhythmias, should consult their healthcare provider before using medications containing pseudoephedrine. Alternative treatments with a more favorable cardiovascular profile may be recommended. Even in healthy individuals, it's advisable to monitor blood pressure and heart rate when taking pseudoephedrine, especially if used in higher doses or for extended periods. Pseudoephedrine can interact with other medications such as monoamine oxidase inhibitors, MALIs, and beta blockers, potentially exacerbating cardiovascular effects. Informing healthcare providers of all medications being taken is essential to avoid adverse interactions. If you found this video helpful, please remember to hit the like button. It really helps us bring you more valuable content. Drop a comment below and let us know your thoughts, questions, or what topic you'd like us to cover next. We love hearing from you. Of course, hit the subscribe button and turn on notifications so you never miss out on our latest health tips and insights. Stay informed, stay healthy, and we'll see you in the next video.